Blood donation is not for the timid. They ask you about your sex life, your pregnancies, your travel, and there's a reason.
We have to meet these standards of safety, potency, and purity. So we do ask these questions. We do expect people to be honest and upfront about how they're responding to these questions.
And now, donor rules have loosened around same-sex relationships, tattoos, and other criteria. More people are allowed to donate than ever before. Does that make our blood less safe?
Male with a male in a monogamous relationship for the last 20 years or something. Is that person more at risk of transmitting HIV than a heterosexual male who has had several new partners in the last 3 months?
Why are they marketing to teenagers through high school blood drives? Is that okay?
We received a call from the high school saying, you need to come pick up your daughter. She's fainted, which she had never fainted before. So when we arrived at the school to pick her up, we learned that she had donated her blood.
After you hear this episode, I want you to decide for yourself how you feel about donating blood.
Your blood, your health, it's in your hands. Speak up loud, take your stand. A voice can shift the tides of care. Your blood, your health, be aware.
If you are not yet familiar with Dr. Joel Addams, then I consider it an extreme privilege to introduce you to him today. He has taught me so much about blood safety, blood components. Thank you, Dr. Addams, for being willing to have this conversation with me today.
Oh, it's my pleasure. Thanks for having me.
What we're going to be talking about is the blood donation process. But I have never donated blood. I did have the privilege within the last month or so to see the blood donation process. You welcomed me into the blood donation center where I learned a lot, got to see a lot, became more familiar. I'd like to bring that to everyone who maybe has not experienced it or seen it for themselves. So I'm going to ask you my first question. If I wanted to donate my blood for the first time, where would I even start that process?
A lot of people have originally been approached, like maybe we'll talk about later, in a high school setting or a church setting or a community setting where a blood drive was put together. However, there are fixed locations throughout the United States in most larger cities, I suppose, and blood drives will come to some smaller areas as well. Either one, of course, would be following all FDA guidelines and would be perfectly wonderful to donate to.
You make a really great point that blood donation, blood collection, blood processing, the whole way through transfusion safety, vein to vein, is regulated by the Food and Drug Administration.
Yeah, it should be stated up front that this is a highly regulated process. Any institution that is collecting blood will have regulatory oversight.
When I go to donate blood, what should I experience? How long is it going to take? How long am I going to be waiting?
It'll depend, of course, on if you're at a mobile drive or if you're in a center. Centers and mobile drives will often have you sign up beforehand, and that is to make sure that there's a person, a phlebotomist, available at the right time to draw you so you're not there too long. Some blood centers will hand you like the donor history questionnaire and educational materials as you arrive. Some will allow you to do that online, which will expedite the process. Once the process is set up, you're probably going to be there about an hour for a whole blood donation. I would give yourself about an hour. Some of your listeners are probably used to the platelet donation, which is part of the blood that causes clotting. When we separate those, that's a longer process for most of us in the US. Our donors plan on about 2 hours to 2 hours and 30 minutes for that whole donation. So that's a very dedicated donor. It's not a first-time donor usually.
Okay. Is there anything I should do to prepare myself if I'm going to donate blood?
There are definitely things to do to prepare. One is to get plenty of sleep and be well hydrated when you come to donate. We also recommend people eat a meal and not come on an empty stomach. What we're trying to do is get away from the risk of fainting or just feeling poorly when you donate. Those things we think mitigate some of those problems. We don't advise drinking alcohol the day before or much the night before. I'll leave that up to your discretion, however, what that means to you. But alcohol does dehydrate you, and we do recommend avoiding alcohol the day of donation.
What kind of things will you be asking?
We give you a long list of questions that will help us determine how safe, potent, and pure your blood product will then be going into a recipient. The FDA and our standards look at those concepts because we're creating a biologic drug for a patient, right? So we have to meet these standards of safety, potency, and purity in order to do that. I think we'll probably get into the testing of the unit as well, but a lot of the things for risk that we want to lower is by question. So we do ask these questions and we do expect people to be honest and upfront about how they're responding to these questions. We'll ask them about, travel history for the question of like malaria, right? Have you been in a malaria endemic area? Have you been in an area with babesia, for example? So the northeast of the U.S. has a similar kind of pathogen that we were interested in. We will test in the northeast for that pathogen. We'll ask things about risk, like new sexual partners within time frames. That's to help us lower the risk of transmitted diseases. We will ask things about pregnancy. And people might ask, like, well, I was pregnant 20 years ago. Why does it matter now? The reason is that there could be antibodies that are not harming the donor, right? It will never cause harm. But in fact, we've correlated those to some transfusion reactions in a patient. So we're screening for that and then testing for that if that person says, yes, I've been pregnant, for example.
When we talk about screening the blood, this questionnaire is the screening process. And we're
Yes,
relying on the person who is donating to be truthful about their behavior, their past experiences, their travel history, their sexual behaviors, whatever is on that questionnaire.
that's right. And some of those questions are specific for the safety of the recipient who will get that blood. And some of them are specific actually to the safety of the donor, right? So we don't want to take 2 units off of them every week, right? That's not allowed because that would affect the safety of that donor. Some are donor specific, some are recipient specific, or
Okay.
both. So the first question, right, that the FDA requires of is, are you feeling healthy and well today? That is a great screening question because if somebody's not feeling well, they're more likely to not feel well afterwards.
Yep.
And also for the recipient, maybe they have a urinary tract infection that it's just starting and they're not feeling tip top. That could affect the blood that we take from that donor, right? And that bacteria that may be some bacteria roaming around their bloodstream, that could cause a problem for the recipient. So that question is a great number one question, because if somebody's not feeling well, we would ask them to come back. As a caveat, actually, I think people might be interested to know, sometimes they find themselves at a church drive, right? Their local church is doing a blood drive. Those kind of places, or at a school drive, people feel responsible to go through with the blood donation. That can be a lot of peer pressure to answer questions perhaps incorrectly or
Mhm.
without a full truth, just so they know they're always handed a number to call
Mhm.
if for any reason, and we don't question those people, they call
Mhm.
back that night or they call back whenever, preferably
Mhm.
as soon as possible, and
Mhm.
say, I don't think you should use my unit for
Mhm.
transfusion.
Mhm.
We don't ask them why. We just discard the unit.
So you could track a
Yes.
unit.
Yes.
Okay. Okay.
Yes. Traceability is an important concept in the blood supply. Those are traced very tightly. We can always trace back to the donor because if something happens that we don't understand in a patient, we need to be able to go back through to the donor.
What kind of things would you turn me away for?
We would defer fairly easily for anything that's like coming up symptomatically for them. There are things that would defer people. We have to do a check of their arms, right? Because we draw in those arm spaces, the crease of the elbow, inside of the crease of the elbow. If those are concerning to us, like there's a rash, say, for whatever reason, most of us would not draw through that rash.
Mhm.
Or, track marks are kind of a sign,
Mhm.
a potential sign of IV drug use. Those are signs that we pay attention to, and we may defer for a time. We do a temperature check. Right? So if somebody, you might be feeling fairly well, you don't feel like you have a fever, but you come back at even 37.9 or 37.8 degrees Celsius, which could be normal for a lot of people, but that is an upper limit. You've reached over an upper limit for us. That starts to increase the potential risk for an infection. We would defer that donor until they are feeling better and we can recheck them, etc.
I've been at work before when maybe they're questioning a deferral and they'll reach out to a physician like you to make a decision. I think it's sometimes there's been like cardiac issues or past cardiac history, and it just kind of depends on your judgment as a physician.
That's true. That's true. And this is a good concept because you might go to one collector in one state or even the same state, and we might go to a different group. And you might be surprised to see that one group would take you and one would not. The FDA allows for the medical directors over those different facilities to decide what they're willing to risk for you, the donor, or not. So there is variation.
But it's great to see that there is medical oversight at all times and that they are trying to protect not only the recipients, they are trying to protect the donor as well. And
That's true.
recent changes that I have heard and read about, I'm thinking back as far as maybe May of 2023, it seemed as though the donation criteria lightened quite a bit. They became more lax as far as like same sex relationships and being able to donate. Things like possibly tattoos or when you get a tattoo, maybe lightening the restrictions. Is that putting the donor blood more at risk, or why did they change their rules and now they're more accepting?
I'll take you all the way back to the 1980s, where we had come out of many years of seeing hepatitis C through the 60s and 70s when blood donation, 50s, 60s, 70s, where that blood donation really started to increase as a concept in the American psyche. And we saw a fairly high transmission of hepatitis C, concerningly so. So that was the milieu in which we went into the 80s with the HIV AIDS epidemic, which
Hmm.
was highly concerning for the blood supply.
Hmm.
So rules were instituted that were very conservative, right? Around that like donor history questionnaire, I'm going to ask you a question to assess risk. Those bars were set very high. So a lot has changed since then. I think it was reasonable to put in bars in place, especially when they didn't have the testing that was really robust or what we would call sensitive. The testing for things like HIV has become very sensitive. As well, the gender-based questions that used to be asked have been tested now really throughout the world. We have good data. Europe actually preceded the United States in changing some of the questions for the donors around things like gender. Instead, they moved to a risk-based assessment. These studies were done in Canada and England, in Europe. The US historically has continued to be very conservative until fairly recently. Data exists that we can ask people risk-based questions, right? Like, have you had a new partner in the last 3 months? So that length of time that we used to defer donors, and the old term, of course, was MSM, men who have sex with men. Those terms are now outdated in the blood supply because we're asking about risk. So
Right.
new partners, and then additional questions about specific risk factors that would take them away. So one example I think that's come up in the literature over the last like 15 years is somebody who's in a monogamous relationship, right? Let's say, a male with a male in a monogamous relationship for the last 20 years or something. Is that person more at risk of transmitting HIV than a heterosexual male who has had several new partners in the last 3 months, right? So that's kind of obvious.
Right. Do you want to highlight the difference between screening and testing for the population? And so screening is very much around the questionnaire. Have you had a recent diagnosis of, say, cancer? No, I have not. That's screened for cancer. And then there's actually testing of the blood unit, which is actually running a test to see if that infectious disease is present. In our area in the United States, I know it does change throughout the globe and the region, but how many different infectious diseases, or what are the infectious diseases that the blood is actually tested for?
Yeah, that's a great question. Some people might ask, why aren't you testing for 100 different diseases? The reason is that most of the diseases that come to mind that you've worked with, it might be a respiratory virus that has a different mode of transmission. So the ones that we're really concerned about are the ones that we know will transmit through a blood transfusion. People might be surprised that there are fairly few in the United States that we do test for, but with every test, with every donation. So if you get a unit of blood or a blood product in the United States through the usual processes, I'm assuming you're in a hospital or a clinic, then it'll be tested for HIV, and that will be tested on every donation in multiple ways. We'll test for HBV, hepatitis B virus, in multiple ways, hepatitis C virus in multiple ways. We'll test for syphilis, potentially in multiple ways. As a caveat, people should understand that we actually have not seen a transfusion transmission of syphilis since the 1960s in the United States. But we'll test for it anyway because it continues to be like a rule and is probably a good idea. But we have not seen that. HIV, by the way, for your listeners, as of the date of this recording, We have not had one confirmed to be transmitted through transfusion since 2008. Just to understand, like, what are your risks? The risks are very low for HIV because we do all these things, right? We've closed the window period through screening and through good questioning. So we're very cognizant of that, but the risk is very low. The risk, by the way, is somewhere between 1 in 1.5 million and 1 in 3 million, right? It's a wide, large number. I have a higher risk, of course, getting in a car accident in my lifetime is probably 1 in 100. That's a risk. And then we test for, so those 4 people are often know about and are concerned about. We test for West Nile virus. We test for Trypanosoma cruzi, which sounds very exotic. We test donors 1 time. It's not endemic yet in the United States, but more of Central South America. So we'll catch donors the first time, but we don't think they're going to contract the disease here. So once we test them, they come back to us. We don't test them for that again. And then we test them for some other ones that are probably less known to the general public, HTLV antibodies. And we do have the ability to ramp up our testing if a new pathogen is identified.
I'd like to switch gears for a minute and talk about the ethics behind blood donation and drives. Often you'll have mobile units and you'll do drives at workplaces, at churches. All of that, I think makes sense. Why are high schools one of the locations, and is it ethical? The reason I'm bringing this story up is because I have a funny shared experience in our family where our daughter in high school donated blood. She was supposed to get a parental signature, which she signed herself. So as parents, we did not know she was donating her blood until we received a call from the high school saying, you need to come pick up your daughter. She's fainted, which she had never fainted before. So when we arrived at the school to pick her up, we learned that she had donated her blood. Upon returning to class, she had sat in her desk and then fainted. Looking back now, we all laugh and it's a funny story, but at the time we felt like that was unethical.
About the ethics of your daughter not getting a proper signature, or about the
Right,
ethics of...
exactly, right. Yeah, there's definitely a family dynamic issue, correct. Why do we use high schools? Why do we market to high schools?
So high schools are an interesting group because they're generally, like you've noted, they're often healthy and well. However, they are under 18, which is generally the age of consent for many things. And that is why states will regulate how young, and it's usually 17, and some states allow 16 to donate blood, but they must have parental consent. If they don't have parental consent, that group will not draw that person. So you brought up an interesting, multifaceted ethical question. You know, whoever did this collection appeared to have had their ducks in a row for consent and drew them. High schools in some areas provide a lot of safe blood for community use. And that, I think that's really wonderful. I'm not sure they're targeted any more than like the college groups. I know being around the folks who really feel strongly about this and put out the marketing and the drives. I mean, they're the best people. They
Right.
really believe
Yeah.
in the cause of getting enough blood to have a blood supply. And if something goes wrong like this, I mean, we feel horrible. We do have a system your daughter's incident would have been reviewed by a medical director, and they would generally, I hope they followed up. I don't know if you remember or not, but we have a close follow-up system to make sure that person is feeling well, a few hours later, and oftentimes the next day. Our people, will call. We have to grade those, and we have to have those on file for the FDA.
Oh, okay.
So the FDA will review all of those, if they want to, right? If they come and they say, I want to see all of your reactions, I want to see all the data on your reactions, these have
Mhm.
to be produced. What you worry about in the fainting cases, which is quite more frequent in the younger population, those, I don't write those off too. They may be a low grade reaction. People usually feel better after a while. We put their feet up, we put cold packs on them. They should eat salty snacks, etc. I worry about people like getting up, falling over, and bonking their head.
Mhm.
And when that happens, now you've had kind of a minor reaction of fainting now become a larger problem that they probably need to be seen. And I'm really sorry to hear about your daughter, honestly.
So she went on to donate, I think, platelets later in life, so it didn't scathe her.
So that's interesting. I've recently had a drive with a friend of mine who has cancer who organized a drive, and his wife had been very nervous. She had fainted in high school, and she was fairly petite, so she barely met the weight requirements in high school and still is petite. So she was very worried. And nobody pressured her, like, you don't have to donate. And she ended up donating again and did not faint as she's 15 years older now. But we do see that older people tend not to faint quite as frequently as that younger population.
Well, and even I was impressed when I visited the donor center. I got to talk to a lot of people, and there are a lot of people behind the scenes organizing and making sure that we have enough for our needs in the hospital. I was speaking to one of the staff members who said she needs to procure about, on average, 22 units of platelets a day. That's the 2-hour donations you had talked about earlier. So that's a pretty big time spend. That's pretty altruistic if someone's going to come in
Hmm.
and donate those platelets. She has to get 22 a day just to make sure that the hospital has the needs met. That's that's nearly one an hour for a 24-hour period.
And that's for a single hospital.
Yes, and that's for a single hospital. That really showed me what the thin line is that we walk between supply and demand that I was
True.
not even tuned into before. I thought that was very interesting.
Yeah, supply and demand is interesting because some people might ask, like, why do you even have a supply problem? And that's because that each of these blood products only has a certain lifespan to them. Those platelets you were mentioning have a lifespan of 5 to 7 days. That means if you're going to run, hospitals that have a trauma bay and have surgeries and transplant and cancer patients, those are going to be the ones that are going to take a lot of your platelets and your red blood cells as well. The platelets, specifically currently in the US and everywhere actually, are really hard to keep on the shelf. We transfuse about 2 to 2.5 million units a year in the US of platelets, and they are always of concern because of their short shelf life. RBCs will last anywhere from 21 to 42 days, right? So we have a little bit of a buffer. However, we're always running low on some of the universal products for them, the O pos and the O negative group.
Before we leave our conversation today, key takeaways, things that you would like the public to know about blood donation or anything blood.
The blood supply is incredibly safe. It's not without risk. Those risks are never zero, but especially compared to 50 years ago, the blood supply in the United States is incredibly safe. I think your podcast does a nice job in explaining this to people that we need blood for when we need blood, traumas, cancer, newborns, etc. People need blood. However, you should also be aware that you don't always have to get blood if you don't need it, right? So you should be empowered as a patient to ask those questions, to say, hey, how badly do I need this? Do I really need it, or do I need it a little bit, or what would you suggest? This study of understanding how much blood you really need is important. I have friends who are now in cancer clinics. They'll call and ask, do I need this? Because I'm not sure and I feel great. And sometimes my answer is yes. Sometimes my answer is no. And that's an evolving understanding of how to use blood products for the maximum benefit versus risk. Because they do have risk as well to use them. So there's obviously risk to giving them. We feel like we do that in a fairly safe way. There are always an unfortunate, an event or something that happens. You as a community allow us to have blood for patients, right? There's no other way to get it at this point. I personally feel like this is one of the great opportunity for communities, whatever that community is, your local community, your state, your region, your country, right? This is like one of the last things we have that you can voluntarily give of yourself, quite literally, to somebody that you don't know. And you're entrusting all these professionals along the way to get that blood appropriately into the patients who need it. And we take that responsibility very seriously. We are dedicated to doing that whole chain of getting safe blood and safe donors and keep them healthy and moving that through processing into the patients who need it. It's, the communities are great. It feels like it fulfills a lot of people who have been affected, or family members, friends who have been affected by health issues that need blood. It's a really, I think, community driven practice that I continue to be very, very happy about this thing. You can tell.
I can. And I think it's wonderful. I've seen people die because of lack of, blood was needed and it was not available or was not there at the time it was needed. So it is an essential part of medicine. I am so thankful for working side by side with people like you that has helped me to trust a lot more in the process and see the process. And I hope that everyone listening today feels a little bit more confident about and knowledgeable about the donor process. So thank you so much for letting me pick your brain.
It's my pleasure. See you at work.
If you enjoy the conversations we're having, don't forget to comment, like, share, and subscribe. It helps bring awareness to the importance of understanding decisions when it comes to your blood.